Hello and welcome to Pisgah Health Today. My name is Angela Owen, and it is my privilege to host this program brought to you today by Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 founded in 2019 by a board of 7 caring individuals focused on improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Dr. Tim Shea. Dr. Shea has been a full-time family physician at Brevard Family Practice since 1998. Additionally, he has served as the Transylvania County Department of Public Health Director for the past 15 years. Welcome to our program today, Dr. Shea. As the entire world deals with this new pandemic we now know as COVID-19, what can you tell us about the public health response?
Yes, thank you, Angela, and thanks for having me. Well, our department at the Transylvania County Department of Public Health has been working for several weeks now to coordinate care with various agencies. We're primarily working through the CDC and through the North Carolina Department of Health and Human Services. There's an interesting mode that we're now operating under, and it actually involves some legal framework. We're basically in what's called an emergency operations mode. And so consider what unfortunately sometimes happens in our state, where we may be devastated by a flood or a hurricane. Well, under emergency operations also comes this situation of pandemic. So the COVID-19 infection is obviously a worldwide pandemic. And I think it's really important for people to understand that this is a once in a 100-year event, just to lend some perspective here. We have additional partners that the Department of Public Health is working with. We have several local physicians who we're gathering input from. Our other partners include Transylvania Regional Hospital. And finally, we're working with the Pisgah Health Foundation, which is a group of several physicians, scientists, and other concerned individuals. So together, we're gaining input from all these folks to try to develop our local action plan. And we're making our recommendations to our local county commissioners. Before I get into a little bit more detail about that, I just wanted to back up for a minute and just talk briefly about coronavirus. This is a virus that I think most of us know started in China back in late 2019. Scientists feel that this is probably a virus that originated in bats and then found its way into some yet undetermined animal that then passed this virus into the human population. From there, it's very quickly spread over several months. It's interesting in the reading that I've done, I've found that about 80% of human viral infections actually originated in animals. So this is not something that's unexpected to have a virus pass from animals to humans. The thing that's particularly challenging, though, about this particular virus is that it's clear that it is spread by respiratory droplets. So whenever you cough or sneeze, there's a fine aerosol that's generated if you don't practice proper hygiene, that then goes out into the environment. The environment then becomes contaminated, various surfaces, which might include your kitchen countertop, perhaps your hand, if you cough into your hand. Unfortunately, when that happens, people then reach, shake hands, touch other objects, spreading the respiratory pathogen, the virus, onto other surfaces. So this virus is very easy to spread from person to person through that type of contact. At this point, we do not have a treatment. There's a lot that's being worked on, and we also do not have a vaccine. but that is also a work in progress. So that's a little bit about what the virus is. Now back to what we're doing about it. So I would have to say that this is easily the most challenging thing that I've been involved in my 22 years of practice. The recommendations change from week to week, sometimes even day to day. And I think our local public officials and the health department is working hard to keep up with those changes. Another important point is that not all regions in the United States are going to suffer this outbreak at the same time or to the same extent. This infection is probably going to occur in waves over at least the next couple of months. There's even some theories that we may experience this wave of infection from coronavirus later this year or next year. Time will tell. Switching on to another topic, there's a lot about testing in the news, and there's a lot about testing in the medical literature. Suffice it to say that testing supplies are in short supply at this point. Even worse is our concern about what medical folks refer to as PPE, or personal protective equipment. When you administer and collect a coronavirus test, it involves a nasal swab that's usually sampling some nose secretions. And that places the healthcare worker at significant risk when collecting those specimens. So right now, testing is only limited under certain circumstances and to certain groups, such as healthcare workers who potentially could be infected. We want to identify those folks and make sure that they don't spread the infection to others, particularly all the patients they're seeing. We also have high-risk patients, obviously, that are hospitalized, and we need to reserve the tests for those individuals to figure out who in the hospital has coronavirus and who does not, so that we can separate those individuals from one another. And then finally, there's other higher risk groups that might include residents of skilled nursing facilities, folks with chronic medical conditions, and our first responders. So, where do you go to get information about this? This is one of my key points. The most important person to get information from is your personal physician. Reach out to them. If you don't have a personal physician, the Transylvania County Department of Public Health has set up a nurse line Monday through Friday, roughly the hours of 8 to 5. And I'm going to give you that telephone number. This is a hotline manned by public health nurses locally in our community. Their phone number is 884-4007. That is 884-4007. Other sources of information might include the Brevard Health Center, as they are accepting folks who do not have a current physician. You can also go online to websites such as the CDC or the North Carolina Department of Health and Human Services. And then finally, there's one additional person that I recommend everyone in the country listen to. If you see Dr. Anthony Fauci speaking on any TV channel, turn the sound up, be quiet, and listen to that man. He has our best interests at heart, and he's very well qualified to put out the up-to-date information on this infection and how we're going to handle it. So finally, I'm going to close with just a couple other thoughts. What do you do now? I've already told you need to listen to your physician. You also need to listen to local officials. We all listen to the news and hear what's going on in other parts of the country. For example, what's going on in New York City now. And that's important to listen to. But their infection is going to occur at a different time. Their infection is going to peak at a different time than ours is. We will experience some of what they are in New York City. And so we need to be prepared. Social distancing. Two words that were never put together that are now part of our day-to-day vocabulary. Other presenters, I believe, are going to discuss that further. It's extraordinarily important. Finally, if you only had to do one thing, I would recommend wash your hands, keep your hands away from your face, please. That makes a tremendous difference on the transmission of this disease. One final thing, just a thought I need to leave you with. If you want to know how to be a hero in this disease outbreak, it's really quite simple. Don't do anything. Stay home. Be bored. Wash your hands. Stay away from other people when you go out. It'll save a life. So be a hero, please. Thanks, Angela.
Dr. Shea, thank you so very much for the words of wisdom and for being on the front lines in public health as we work together to battle this horrible pandemic. We also want to thank Wildflower Media for their creative and technical support in helping us to put together this program, as well as the Physicians Roundtable, the board, and the staff at Pisgah Health Foundation for their continued response to these challenging times. If anyone wants to reach out to the Pisgah Health Foundation, you can email them at info@pisgahhealthfoundation.org. Thank you again, Dr. Shea. I want to invite our listeners to stay tuned. We will have more information coming out on this. Everyone stay well.